Okay, Gopika will start.
Yes, sir.
Professor Arul, very good evening to you and welcome to Air Quality Management lecture series. This is the 39th month lecture. So this lecture being organized with collaboration with IIT Madras, Air Quality Management Association, and also CEPHA network. Next. So as I mentioned to you, this lecture series started in October 2020, and basically it gives a forum for young researchers, scientists, engineers, educators to have a common platform to exchange ideas among themselves. So it also provides recent technologies in the area of air quality management and also provides an opportunity for collaborations with various stakeholders and experts. Next. So these are all, some of the eminent speakers who gave lecture in the past air quality management lecture series. Next. Yeah. So the last lecture was given by Professor Anil Namadev, Northumbria University, Newcastle, UK. Next. So in order to continue our engagement with the research community, we also started Air Quality Management Association just to exchange not only science and also to understand the technological aspects where the technology can be very effective in addressing the air pollution problem, both in indoor and outdoor. Next. So this is our another network initiatives. It's a clean environment, planetary health in Asia, and this was the kind of the initial support which was provided and continued in supporting this air quality management lecture series, basically under the broad theme of engagement, identification, strengthening the collaboration, build capacity and capabilities, and generate resources and research income to sustain this CEPHA network activities. Next. Of course, we successfully completed the 8th Indian International Conference on Air Quality Management. So we will look forward the large participation in the 9th Indian International Conference on Air Quality Management. It will happen in a year. Next December, we will find out the dates and share the details. Next. Okay, so I welcome all the participants to this lecture, and now I ask Gopika to introduce the speaker.
Thank you, sir. Greetings to everyone present. It is my pleasure to introduce the speaker for the day, Dr. Arul Veerappan. He is currently an assistant professor at the Division of Environmental Medicine, Department of Medicine, New York University, USA. His major areas of research are environmental toxicants, such as heavy metals and air pollution, including the World Trade Center particulate matter, cardiopulmonary health effects, and carcinogenesis. Dr. Arul has published his research work in high-impact top-tier journals such as NPAS, Nature Medicine, Translational Science, etc. He has also presented his work at various national and international conferences. The lecture for today is titled Urban Air Pollution and Health Effects, Overview of the Recent Canadian Wildfire Episode in New York City, where he'll be discussing the importance of PM 2.5 and heavy metal monitoring, not only in the urban traffic sites, but also from wildfire events, such as the recent Canadian wildfire episode and its effects on the population of New York City. Sir, we welcome you once again. Please share your slides for the presentation. Thank you.
Morning, everyone. Thank you, Gopika, for the nice introduction. Also, I would like to thank Dr. Sivanathendra for this opportunity, giving this opportunity. Today I'm not going to talk about a subject entitled Urban Air Pollution and Health Effects, an overview of the recent Canadian wildfire episode in New York City. Spring 2023 was an extreme wildfire season in Canada with the dramatic air pollution implications. Normally prevailing west winds carry results particulate matter, PM 2.5 out to sea, but during early June 2023, an unusual meteorological situation arose wherein a low pressure weather system became stationary off the US Northeast coast, including strong north winds that carried the wildfire pollution directly south to into the United States. So air pollution is one of the greatest environmental risks to health. It is a major cause of premature death and disease. Also, it is the largest environmental health threat globally. By reducing air pollution levels, countries can reduce the burden of disease of stroke, heart disease, lung cancer, and both chronic and acute respiratory diseases, including asthma. Emissions from wildfires worsen air quality and can adversely impact human health. Atmospheric particulate matter is of great concern to the public and to government agencies because of the health effects and has episodes associated with it, especially PM aerodynamic diameter less than 2.5 micrometers in size has the strong potential for absorbing toxic metals, which may then enter the human body through inhalation and have adverse physiological effects. So before talk about the New York episode, I want to touch base with the California wildfire air pollution. So in general, West Coast states of the United States, such as California, is often affected by wildfire. Since the 1980s, the size and intensity of wildfires in California have notably increased. 15 of the 20 largest wildfires in California history have occurred since 2000, and 10 of the most costly and destructive fires to life and property in the state have occurred since 2015. The smoke produced from the wildfire or the campfire exposed Californians to dangerous levels of PM and continued concerning levels of toxic metals contaminants include lead, which is spiked for about 24 hours. I'm going to show in the next slide. Campfire, which burned for about a 2.5-week period, elevated levels of heavy metals such as lead and zinc were detected, as well as calcium, iron, and manganese. Smoking containing these metals traveled more than 150 miles and was detected in the air as far as away as San Jose City. So you can see this graph. It's 2018 to 2019. You can see in the peak of lead metal from the roughly October or November 2018. So coming to the New York City wildfire air pollution episode and health effects. As I said before, similarly, the urban residents are often affected by either natural or man-made pollution cascades. The recent Canadian wildfire smoke exposure affected millions of New York City residents is one of the examples. For more than a week, the acute wildfire was hanging around New York City area, and hundreds of thousands of people remain at risk due to the exposure to toxic air. As I said before, it was a low pressure developed in the city, so it's hanging around for almost 2 weeks. The air quality in New York City is generally good and has been improving over time. For PM 2.5, New York City meets the National Ambient Air Quality Standard of an annual average under 12 microgram per millicube, and the 24-hour average is 35 microgram per cubic meter. However, these levels are greater than American Thoracic Society recent recommendations. It's about 80. They reduce the level is safe level for the human health, 8 microgram per cubic millimeter for long-term PM 2.5. So the long-term exposure to PM 2.5 contributes to an estimated 2,000 excess deaths from lung and heart disease each year in New York City, and the short-term exposure contributes to asthma incidents severe enough to require a trip to the emergency department and other health threats. New York City's air pollution ranked the worst of any city in the world on Wednesday, June 7th, 2023, as wildfire smoke from Canada contributed to drift over the area, creating a second day of orange haze over the city and prompting some residents to wear face masks outdoors. I will show the picture in the later slides. As of 7th Wednesday afternoon, the city reached an AQI of 342, a level considered hazardous for all residents. The Federal Aviation Administration on Wednesday halted some flights bound to New York's LaGuardia Airport due to the smoke. You can see this slide. It's May 25. You can see the air quality. There is no threat to the New York City area or Northeast, of course. But the June 1, this was June 1, you can see the trace coming from the north. And this is June 7th. You can see the acute impact in the Northeast region, especially in the New York State, including the New York City. So this is green contours. So this is monitors daily AQI. Again, the Northeast region has the high impact due to the Canadian wildfire. So this is the iconic place in New York City called Times Square. You can see the skies in orange. So this is smoke from the Canadian wildfires blankets New York City, affecting air quality on June 7th. The picture is showing the Brooklyn Bridge. And here the picture view from Hudson and the East River side. So coming to the point, the health effects, the asthma-associated emergency department visits during this wildfire smoke even has been drastically increased. It's not only the New York City area, but also the other part of New York State. If you see, if you see here, you can see the first one is New York State, then the Upper Hudson Valley region, then Eastern Lake Ontario region, then the Central region. Asthma-associated ED visits increased over 80% on the particular day, June 7th. So still more results are coming up. This is a preliminary study. What I showed earlier, a few studies only so far out for the this year. The results of the recent studies indicate that daily mean PM 2.5 and the number of asthma-associated emergency department visits was increased not only in New York City, but also throughout the state of New York during June 1st to June 14th. So monitoring and targeting PM 2.5 and heavy metals in air pollution is vital, not only in traffic-related air pollution, but also wildfire events. So this shows the New York City has 5 boroughs: Manhattan, Brooklyn, Queens, Bronx, and Staten Island. You cannot see much clear, but you can see the some areas are highly affected. So this, as you know, this is the standard air quality index. So this is my short lecture. I don't have much because of this is a new topic in New York City recent wildfire. But however, I would like to give another long lecture in some other time. So if you have any questions, I will take from them.
Yeah. Okay. Thank you, Arul. It's a very short lecture, but it was an interesting to look at it. Just like to understand, is it a first time happened, this kind of an Canadian fires, influencing the air quality in the New York City, or maybe some other cities in the US?
Usually this kind of wildfire happening not in the New York City or Northeast region, usually happen the east side, especially California, Nevada, all other states. But this is the very first time we had this kind of episode. This is even not from the New York or US fire. It's a fire from Canadian space. It got through over from flow through the north to south. So
Okay.
that also, but another thing, important thing, because of the low pressure formed in around the New York City area, it halted for the bad air quality was almost 2 weeks stayed in the New York City area.
Okay. And did any studies carried out to understand the health implications, whether during that period any
Yes.
increase in hospital admission, something like that?
Yes, as I showed, this is only few studies so far, but it's all other studies are underway. So hopefully we can expect next in another few months we will have more papers out. So you can see.
But is there any reports related that okay, this particular because of this, any of those cities where the pollution levels are increased, and hence there is a maybe the respiratory related, the breathing complaints has been increased because the complete area was smoked.
Yes, actually that time, if you see that slide shows emergency visits increased, particular that week and the week after. So that shows there is something going on with this bad weather, bad air pollution thing.
Okay. Arul, I'm just trying to look at it because there are two aspects of the air pollution monitoring requirement. One, the regulatory agencies keep setting some monitoring instruments to understand the air quality in that particular area. So the other aspect is as an health professional, to what kind of, how do we combine this? Whether the data which is being used by regulatory purpose is very, informative or beneficial for the health research studies, or you prefer some kind of a monitoring that will be, required for health risk assessment?
Yes. Actually, in New York City, the state New York City department, they installed several monitors, air pollution monitors in the several places of New York City near the roadways or interior uh, or near the industry area. There are several places they install and they keep monitoring the air quality. Of course, the point is we have to connect those monitoring data with the hospital data. As you said, that's very important to moving forward and curbing this air pollution. So yeah, we have to connect that. We have to compare with the hospital admissions and even the within the hospital admission, what are the lung of health as well as cardiovascular health. So there are some data, but it's still the studies are underway, and they are going to also. Yeah, the recent studies not only for the wildfire, the same as the COVID. Also, New York City was heavily affected. So that's another part. But anyhow, the comparing the air quality data with the hospital data are more important. This.
And is there any some research, medical, environmental research, particularly focused towards health risk? Have some kind of a consortium to try to pull out all the resources to get a larger impact of how this data and monitoring could be beneficial to the society. Is there in some aspect happening in that direction?
Yes, not the like a consortium, but individual hospitals. We have in New York City like 4 or 5 major hospital network. One has a New York City government-based hospital network that's called the New York City Health and Hospital Corporation, and other private hospitals, and they have their own cohort, the data, so they are going to for doing research, we can access those data.
I'll just, are there any questions from the audience? Please type your questions in the chat box. Okay, what kind of research, like, since you are quite long, you are working with air quality, and also not only air quality, you are trying to look at it, the variety of environmental qualities influencing the health. So what do you think that how we can bridge, because now there are a lot of instruments coming up, a lot of data are coming up. How do you think that look at it the 10 years back and the kind of research the student should look at it maybe in the future, because increased monitoring and data?
Regarding the air pollution, as I briefly mentioned, if you see the long-term health effects of air pollution is more towards the carcinogenic, later you can see that. Because I believe this is because of the heavy metals present in the air pollution, because the chronic exposure to heavy metals easily that cause adverse human health effect. So that area is not explored very well, although independently there are so many studies trace elements induced carcinogenesis, but in the air pollution side it's not that much studies available. So that the whoever interested they can focus in that area, would be beneficial for.
Okay. The other question is, like, for Indian context, I have not seen in US, but in India we have air quality standards for ecologically sensitive area, air quality standards for industries, residential area, but the characteristics will be quite different. Do you also have some regulations for the traffic side or for the industries, or maybe I don't know whether?
So
you also experiencing the air pollution from the construction site?
So the New York City has some restrictions. They want to reduce the cars. They discouraging having the car, or most of the cars vehicles coming from outside the New York City. Now they are controlling, put the more tolls for that, so they're reducing. Also, if a vehicle is not operating, they just standby, they cannot run the engine, they have to stop. So these kind of rules are here, so that will help the reduce the air pollution in the city.
Okay. I'm trying to understand from the health point of view, just to look at it, is it an air quality in an industrial area, or air quality from the traffic site, or air quality from the construction site? Which one you think maybe considered as more toxic?
That's an interesting question. But anyhow, I wanted to here express my view. The PM, so particulate matter, not only the size is important, also the sources of PM is very, very important, because even in this wildfire, the West Coast wildfire, Canadian wildfire, we have seen a lot of heavy metals, but we haven't detected any notable heavy metals in the New York. Recently we had it. So the source is very important, where the PM is coming from. So the industrial source, mining, coal mining. So again, the source is important.
Okay. And what kind of background you feel that it is beneficial for the students? Particularly, we know as an engineer, we want to do some health risk assessment, and probably the lack of understanding with several aspects of the biological component. So what do you think?
Yeah, I think,
particularly.
yeah, this is a very good point. I think we have two sides. One is engineering side, another one is health aspects or biological side. We have to join hand together and collaborate each other. Then only we can get a very good, nice output from the studies. As you said, there are a lot of data with you, the same group like that. There, we have to compare with the health aspects, the particular period or longer term effects. So I think first initiate the collaboration with the engineers and basic scientists or physician scientists. That would be helpful for this.
Okay. So my other question is, how do you think, from the research university point of view? So what is the, kind of research, maybe short-term goals achieving, in terms of, earlier we used to talk only medical means it's only completely on health, but now we are only looking even the causative factors, which influencing. So from the air pollution point of view, so what kind of research you think that maybe students should focus, in order to, get their the new informations for the research community?
I think the air pollution affect the lungs. That's the lung is the primary target. So they can look for the lung health. Then also it affects cardiovascular health, the secondary. For the other thing, of course the air pollution affects the skin, so they can focus these areas. Of course, now they have a lot of modern instruments. They can even non-invasively they can access the lung health, so they can
Okay.
focus.
So there is one question from the chat box. Do in the New York City, do you have something called a clean air zone or ultra clean air zones, similar to London or in UK? If they are existing, then what kind of policy being made to create such things?
As far as I know, I don't think so. Any place called like that clean air zone, but we have quite a large area of park called Central Park in the Manhattan area. It's a huge. So there you cannot see any pollution there. Of course, that's a more green area. So maybe that is considered as a clean zone area.
Yeah, this is another interesting question. It's again from the regulatory from Pollution Control Board. So they were just looking at because in India, you know that solid waste burning is a major issue. Sometimes it happens intentional or unintentional or natural. So do you look at it? Are there any such measurements like dioxins being looked? Because there are some, as the new pollutants are emerging, do you see that are there any emerging pollutants and relating that to health risk, and what kind of measurements are required?
That's an interesting question. Actually, this field is another focus. Actually, you asked before, so I'll tell you the student can focus the areas bio monitoring. So that means what are the levels of these toxicants in the wherever in the water, air, or any waste material, or even indoor air, outdoor air. There are some investigators focusing on that by biomonitoring, but in New York City, like a few years ago, there are a lot of BPAs. Bisphenols are more predominantly detected, and water, I believe. So they focused on that, but other than that, right now there is anything. As far as I know, I don't have any answer for that.
Okay. And there is a lot of research now fueling to this microplastics. So what do you think microplastics, both in air and water, so their relevance to health risk?
Yes, that's a very hot topic now. So that's an interesting another area for students to focus their research. Anything, even in the air, water, from anywhere, the microplastics can be detectable. So yes, of course, that's an interesting field.
Is there any research going on in your university related to microplastics and health risk? What is their focus?
Yes, actually, one of my students have started that, but unfortunately, he cannot continue that. So we will continue that later, but not right now.
Okay. Yeah. So just wait. Maybe are there any questions from audience? Okay, there is one more question. Thanks a lot for interesting talk. Okay, he is living in an area of coal mining, and coal burning is the major activity. Are there any regulatory measures for mining industry in protecting human health in the area? Okay, this is a really interesting question. Particularly in the coal mining, a lot of heavy metals can contribute. Are there any specific study and any any plans made or policies made to control exposure to the coal burning related emissions?
Yes, actually, if the coal burning, as you said, a lot of heavy metals, particularly mercury, high level of mercury, you can see that. In US, recently, I was reading an article about the police. It is connected to the cardiovascular health. So once they close that mine, they reduce the cardiovascular adverse effect. So that means it's highly related to cardiovascular health, I believe.
Mm-hmm. Okay. And
But
the other
as
question
far
you
as
have,
the regulatory aspects, I'm not sure about. I'm not expertise on that to comment on that.
okay, that's good. Are there any control, because air pollution, one aspect is that, for example, all of a sudden, if there is a situation like what you mentioned, thick smoke coming and settling on the city. So, of course, the one is just allow the natural, ventilation to clean up all these things. Are there any other mechanism where they install some purifiers or increasing the air circulation in this area? Have you come across such things in any of the city in US?
So, of course, in the all offices, hospitals, and because New York New York City that doesn't have individual houses, all have the apartment styles. The modern apartments, they have HEPA filters. Also, the hospitals and offices, they have HEPA filters. However, during this Canadian wildfire air pollution episode, there are a lot of people bought the new air purifier for their home. So that's why they can breathe the clean air. So yeah.
Okay. Do outdoor, how they're managing it? For example, we in India, we are just exploring setting up of large scale air purification system in the streets, construction sites, even some industries. So this is also taking place, and not to the scale of what China has been introduced, like big, air pollution control towers. But I don't know. Do you such practical examples available in order to address the air pollution in the cities? I also would like to know: is there any resuspended dust? Because in India, you know that there is a lot of dust deposited on the road. Particularly, any construction activity near, you will see a lot of dust deposition. Any such mechanism to address these problems?
So you said you have Chennai, they have the clean the air pollution instrument?
Yes, we have some, not to the extent, but there are some activities like setting up of, in particularly in Delhi, they have set up several air purifiers, ambient air purifiers, not only in Delhi, in Mumbai also.
Okay. I'm not sure how much effective the outside air purifier, but I don't think so. As far as I know, I don't think so in anything in the New York City, only the indoor that we have. But other than that, I'm not sure about the outside one.
Do they, but of course, the climate is one maybe helping to, not to bring too much pollution from the roadside. But in India, it's a tropical country, that we have a lot
So
of dust
that's
pollution.
also, as you asked before, the construction, building, these kind of thing, they have strict regulation here, so they have to cover everything, and once they done, they have to clean with the sack, everything they have to transport from other place. So those kind of regulations will help not to pollute too much.
Okay. Maybe the last question from my side. As a health risk, health expert, to understand the regulatory point of view, the standards have been designed several years back, but there are not much standards available for these emerging pollutants, particularly when you talk about microplastics or maybe some of the VOCs which we have not come across. So, what is your thoughts on this?
Yes, this is very interesting question. I like that because, as you know, the BPA has been bisphenol A has been banned here, US, especially for the baby feeding bottles and most of the plastic bottles. But however, the industries, they replace the BPA with similar compound, similar structure compound, such as bisphenol S, bisphenol F, but the structure is very similar. They just change the name with the similar structure, then they replace it. So that will, again, maybe not now, another 10 years, we may find that it's also very toxic or carcinogenic. So regulatory department has to play very vital role in this. Otherwise, it's very hard to control.
Yeah, thank you, Arul. It was an interesting talk, although you have presented very briefly, but you have discussed quite a lot based on your experience. So just to, as a token of our appreciation, we'll just have one group photo to record in our page. Please, I request all of you to start your camera. Okay, Sarup, will you take? Yeah, maybe others quickly. Yeah, Chaitra, Prakash. Wait பண்ணுங்க. Okay, yeah, can you start? Take.
Thank you.
Okay. Yeah, thank you, Arul. And yeah, so we'll see you soon, maybe in some other discussion.
Okay.
Yeah, thank you very much.
Thank you.
So on behalf of Air Quality Management Association and IIT Madras and Indian International Conference for Air Quality Management, we would like to thank all the participants who are taking their time early morning in the Friday for attending this talk. Arul, thank you very much, although I know that it is a little late for you.
Yeah,
but thank you very much. Good night to you. Thank you for all. Gopika, thank you.